Mr. Speaker, I yield back my time.
The gentleman yields. Under the Speaker's announced policy of January 3, 2013, the gentleman from Tennessee, Mr. Rowe, is recognized for 60 minutes as the designee of the Majority Leader.
Thank you, Mr. Speaker, and we're here for the next hour to discuss the Affordable Care Act with my colleagues and my co-chair in the Doctors Caucus, Dr. Phil Gingrey, a fellow OBGYN doctor from Georgia, and I thank the gentleman for being here today. We're going to break this hour up into several segments and talk about, number one, how the Affordable Care Act was initiated, how it actually came to be, two, the promises that were made by the President and by the Democratic Party about what the Affordable Care Act would do, the failures, which I think are probably fixable, of the website. I've said this. I mean, we certainly have in 1969 put a man on the moon with a slide rule and a handheld adding machine, and surely we can get a website to work in the year 2013. I think that will be something. If we can't overcome that, we are in trouble. Number four, I want to discuss something very near and dear to my heart because I participated in this for years, which is medical education. We have and I'll go into this in more detail, we have a huge doctor shortage in America today, and it's getting worse. A major university in my state, university, this past year, that university has lowered their workforce by approximately 1,300 people, will by the end of this year, and very disconcerting for those people who lost good-paying jobs. We've had hospitals close in our region. We've had layoffs in our area in the healthcare industry for the first time in my medical lifetime, which has been over 40 years as a physician now. Also, very distressing to me as a doctor and as a faculty member of the College of Medicine at East Tennessee State University, the Quillen College of Medicine, is at Vanderbilt University, is reducing their class size by 10%. And they're also reducing the number of MD PhDs that they have. These are our future researchers to find the great cures for diseases in the future. And there's a pipeline out there, and we certainly know that a vast number of our senior doctors are considering or have retired, as my own personal physician has done, due to the effects of the Affordable Care Act. So we'll discuss that in more detail. And I think also we need to discuss and focus on the new taxes and also on the effects on business. And then lastly, perhaps it hasn't been discussed much recently, the effects on Medicare. Quite frankly, with $700 billion being cut from Medicare. And there's one particular part, Mr. Speaker, of this bill that Dr. Gingrey and I have worked on closely together in the Medicare portion of the Affordable Care Act. It's called the Independent Payment Advisory Board. It hasn't gotten a lot of press because it hasn't affected any seniors yet. But it's a board, an independent board, independent of Congress, that will determine how Medicare dollars are spent. And we'll go into that if we have time in more detail toward the end of the hour. I think that's one of the most egregious parts of this bill when it comes to our seniors. And we're adding 10,000 new seniors per day, each and every day, over 3 million per year, with a decreasing number of physicians and less money in that very needed program that needs reform. Let's go back, Dr. Gingrey, approximately 4 years. When we were here on the House floor debating this bill. And the premise of the Affordable Care Act I completely agree with, which is to lower costs and increase access to care. That is a noble, noble goal to have, and I still share that goal to this day. There were three committees of jurisdiction in the House of Representatives that looked after the Affordable Care Act: the Ways and Means Committee, Energy and Commerce, and the committee I serve on, Education and the Workforce. Those committees had a bill brought forth by the House of Representatives, was voted on, debated in the various committees, brought to the House floor, and was voted on a straight party line vote. That particular bill did not include the IPAB and some other things that are in the permanent bill, the so-called Obamacare or the Affordable Care Act. The Senate then voted on Christmas Eve, I believe it was, 2009. Brought a bill back over here the following month. We debated again on the House floor for a very short time, And famously, our then speaker said, we had to read the bill to find out what was in it. Well, guess what I did? It's a 700-page bill, but I felt like that a bill that affected every American citizen in a very personal way deserved my attention. So I read that bill. And the surprises that you're seeing now, I've been talking about now for 3.5 years, as have my colleagues on the Doctors Caucus and others on our side of the aisle, and many, quite frankly, recently in a bipartisan way. And the only thing bipartisan about the Affordable Care Act was its opposition. I think some 32 Democrats voted against that bill. So it comes as no surprise to me when the President says, and we'll go over the broken promises in a minute, it comes as no surprise to me when the President says if you like your health insurance you can keep it. That wasn't going to happen. And why did I know that? And let's go over the promises that were made. And this is, number one, was universal coverage, and I quote, this is the President saying this. He wasn't the President then, but this was in June of 2007. I will sign a universal health care bill into law by the end of my first term as President that will cover every American. Well, that's a promise that hasn't been fulfilled. It does increase access by a massive expansion of Medicaid, and we'll go through the Medicaid expansion in just a minute about why some states chose to do it and why our state of Tennessee has chosen not to, and there are very good reasons why these governors have chosen not to. There are a host of unintended consequences of this bill that we're dealing with today. The decreased payments to our hospitals have forced some of our rural hospitals, and certainly where I live in rural America, has put great strain on these hospitals. Even in the more major medical center areas, as I pointed out at Vanderbilt University and many others. I've talked to colleagues today in Indiana who've experienced the same scenario. So the promises that were promised, there would be no new taxes on the middle class. Here's the President's quote, I can make a firm pledge under my plan, no family making less than $250,000 a year will see any form of tax increase. Not your income tax, not your payroll tax, not your capital gains tax, not any of your taxes. That was September 12, 2008. The third promise, and this is one that anybody who has studied health insurance and has dealt with it in private business as I have knew was not going to be possible, was the outrageous claim that by the end of his first term that premiums would decrease by $2,500 a family. I mean, anybody would know better than that that's ever run a business. And this is a quote, we'll lower premiums by up to $2,500 for a typical family per year. We'll do it by the end of my first term as President of the United States. That was June the 5th, 2008. The next promise was there would be no increase in the deficit. No increase in the deficit. And here's the President's promise. I will not sign a plan that adds one dime to our deficits. That was promise number 4. And the last one, promise number 5, is if you can keep your plan if you like it. And here's the quote. If you like your doctor, which, by the way, I like my doctor a lot. I went to medical school with him. You'll be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan, period. Well, let me point out at the end of that period that people who work for me now in this congressional office have lost their plan. So that's not true. No one will take it away, no matter what. Well, I certainly don't see that as being true. The failure of the website rollout, we'll get into that a little later. I think that, as I said, is certainly, if we can't correct a website, if we can't build a website, I have no faith that this plan will ever be workable. I'd now like to yield some time to my good friend and colleague from Georgia, and we've been joined by Dr. Paul Brown, also from Georgia, a family practitioner. But I'd like to turn it over now to Dr. Phil Gingrey from Georgia.
Mr. Speaker, I thank the gentleman from Tennessee, Dr. Rowe, for yielding time to me. It is incredibly concerning that the Obama administration has continued full speed ahead on a rollout of a system, even after numerous warnings from vendors and from Congress. The website has led to confusion in the insurance marketplace, as well as put consumers' personal information at risk to lax security protocols. even after the website is technically fixed, Mr. Speaker, as Dr. Rowe mentioned, and it probably will be, consumers will still face higher premiums and the likelihood that they will be unable to see the doctors to which they have grown accustomed. Mr. Speaker, I have heard from a number of my constituents in the past few weeks about the disastrous effects of the President's health care law. I will take a little time this evening to share with my colleagues a few of the observations from good, solid Georgians. Tom, a Georgia Blue Cross customer, told me his Blue Cross policy went up originally by about $50 due to the Affordable Care Act. About 2 weeks ago, I got a note that said my old policy no longer exists and my new policy will now cost $100 more. That's a quote from Tom. Dottie from Metro Atlanta told me that her husband's employer was forced to drop their family plan and would instead offer them only 2 more costly options. Either plan would increase their premium by at least $160 a week, Mr. Speaker. And a mother in my district told me that her young daughter's Humana plan was canceled only 2 weeks after being promised that the price of the new plan would be locked down for a full year. Mr. Speaker, the President kept telling the American people, and this is the quote, if they liked their insurance, they could keep it, period. And the period is part of the quote. It should have gone on, as Dr. Rowe suggested, until they can't. This promise has surely been broken. Millions of citizens have received cancellation notices from their insurers. They are now left with uncertainty over whether this new coverage will also be affordable. And speaking of affordability, Mr. Speaker, let me share with you a few other stories from constituents, and then I'll yield back to the gentleman from Tennessee because I know there are other members on the floor that also wants to speak on this issue. Mike told me that Obamacare, quote, has been a financial disaster, unquote, for his family. It used to cost him just under $300 a month to cover his wife and daughter on his insurance. But under Obamacare, even that bronze plan, you know, there are 4 options, and bronze is supposedly the least expensive, will cost him $700 a month, and get this, Mr. Speaker, $5,000 deductible. He was formerly paying $300 a month. If you like your insurance, you can keep it. And as Dr. Rowe said, Mr. Speaker, everybody's premiums are going down on an average of $2,500 per year. Not so. Teresa from Cartersville, also in my 11th Congressional District of Georgia, she and her husband told me that their premium is increasing from $550 to more than $900 a month. That's almost, Mr. Speaker, almost a 40% increase. Robert from Metropolitan Atlanta, again, a little part of my district, told me that even though they were underwritten in June, his wife's policy had increased from $387 to $557 a month. That's a 30% increase. Finally, before I yield back to the gentleman from Tennessee, Robin from Atlanta received notice that her family's premiums will increase by 15% without any additional benefits. I'll yield back to Dr. Rowe, and I look forward to continuing this discussion with my colleagues as we go through the evening, and I thank him.
I thank the gentleman for yielding, and let me back up a little bit so that this is a little bit more understandable for people. Typically in this country, and we had problems, there's no question we needed health care reform. I think everybody in this chamber, it's one of the reasons that the doctors that you see here tonight ran for Congress, is because we wanted to be part of the health care reform debate here. Unfortunately, we were not. There were 9 of us in our physicians caucus on the Republican side during the health care debate. Not one of us, not one, was included in the debate on health care. Not any amendment. We offered 80 amendments, to my recollection, to this health care bill, and not one was allowed to be heard on the House floor and voted on. This would be a better bill if the other side of the aisle had simply slowed down, taken a breath, and let us help amend this bill. And people say now, well, Phil, can't you just tweak it a little bit and help? No, you cannot. It is so complicated and so expensive, it is very difficult to do. Now, this bill does do some things I like. I do like the under 26-year-old being able to stay on their parents' plan. The private market would have offered that. You also had a problem with pre-existing conditions, and I want to spend just a minute with that because it's not totally understood or not understood well by the public. We worry about us getting a pre-existing condition, losing our insurance, and not being able to get covered. In America, about 160 million of us get our insurance through our employer, through ERISA-based plans. The pre-existing conditions do not affect those plans. You cannot be denied coverage. As my practice had an ERISA-approved plan, you had to take everybody in the plan. Number two, if you get Medicaid, you cannot be denied coverage. And number three, if you have Medicare. So it really left the small group market and the individual market and the uninsured. Now, people are wondering, why did I lose my insurance coverage? In other words, I had a policy I liked, and I want to tell you today, Mr. Speaker, one of the most arrogant things I think I've ever heard in my life, I heard on TV this last week by several pundits, and those comments are this, that your insurance is no good. I heard the President say that. Well, look, not everybody can eat at Ruth Chris. Some people have to eat at McDonald's or have to eat at Shoney's. They can't all eat at the most expensive one, but they buy what they can afford and what meets their needs. And the reason that the costs are going up so much are the following. In this bill, there's something called essential health benefits. You don't get to decide what you buy for your family. The government decides what you buy for your family. And let me read this to you because I want you to hear this very closely and see if you need all of these services. One is ambulatory patient services. That sounds pretty good. Emergency services. Sure, you want a plan that covers you when you go to the emergency room. Hospitalization. Absolutely. I think you'll see most plans do that. Maternity and newborn care. Well, I don't know about that. What does a single 30-year-old male need maternity care for? What do I need maternity care for at my age? I certainly have cold sweats thinking about that right now. Mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, chronic disease management, pediatric services, including oral and vision care. Well, if you're in a family at an age where you don't need all of those things, probably your plan doesn't hit some of those. If you miss any of them, your plan is not an approved plan. The second thing that made you lose your plan was, and if you read the plan, and this is where I challenge the President here tonight, one of two things occurred. I read the plan, and I understood by reading that plan if you changed anything in the bill, if you changed your prescription drugs, if you changed your copay, if you changed anything significantly in that plan, you lost your grandfathered status, or if you didn't meet the essential health benefits. No one said that. So if the President had read his own bill, he would have known that and would not have come out and said, if you like your plan, you can keep your plan, because that clearly isn't true. Or number two, as Congressman Kurt Schrader said today, that we were misled. I think that's the term he used. So either of those two things occurred, if the President said you can keep your plan, or he just did it for political purposes, which I hope he didn't do, because a lot of people are hurt. 16,000 low-income small business people in my state had a plan called Cover Tennessee. It wasn't the greatest plan in the world. It covered, I think, 12 doctor visits a year, all preventive services, an operation. It covered up to about $25,000. It didn't have lifetime limits, but 16,000 people had that. They could afford that. And many of them bought a catastrophic policy so that they had something that cost more than $25,000. They were covered. So it was basic health insurance coverage. It did for them and their families what they needed, gave them some certainty and peace of mind. That's all gone. They've lost that. I have, as Dr. Gingrey was pointing out just a moment ago, he was mentioning some people in Georgia. You can find this story from the Atlantic to the Pacific Ocean. One story I heard this weekend, an employer of mine he is a building contractor. He's looked at his business. He has 110 employees. He said, Phil, I think I'm just going to have to pay the $2,000 fine. I can't afford what they're going to force me to buy. I can't do it and stay in business. I had an employee that I know personally because she works in my office, whose insurance is going to go from $400 a month for her family of 3 with the Obamacare plan. If you like your plan, you can keep it, to $800 a month. This is an employee who makes in the mid-$50,000 range. This is not somebody who's rich who can afford this. That's a car payment or college education payments or whatever she wants to spend her money on. You can hear this story over and over again. 66,000 Tennesseans got a letter from Blue Cross explaining that their plans didn't meet the essential benefits package in the individual market. That's one insurance company. And this is going on all over. So this business about the cost going down, I think we'll be on the Key Bridge jumping in the Potomac River when we finally get the bill for this. That's how expensive it's going to be. And by the way, most people don't understand this. A lot of our governors that read the fine print, and our Governor Bill Haslam, a good friend of mine in Tennessee, wanted to expand coverage. He wants to expand coverage, but he wants it done through market-oriented principles. And one of the things that we have had in Tennessee with our health care coverage expansion is that we went through health care reform 20 years ago. 1993-94, we began a program called TennCare. In the TennCare plan, we had a problem with access, and not enough people had coverage in our state. So we did this, and within 10 short years, our spending had tripled, and half the people, almost half, 47% I think, of the people who got insurance on TennCare dropped their private health insurance and got it through the TennCare program. What our Democratic governor, Phil Bredesen, did in the mid-2000s was, because we have a balanced budget amendment in our state, was he had to cut, with the approval of the legislature, 200,000 people from the rolls. And people say to me, Dr. Rowe, don't you think this bill will just fall under its own weight? And I said, no, I don't. And the reason I don't is because the federal government can deficit spend. We can print money here. If we had to have a balanced budget in this body right here we're standing in, I can assure you we'd be having a different discussion about this bill. One other thing I want to read about the governors that have signed up for this great deal with Medicaid, which is a program for our low-income people. And by the way, I want to publicly state that the group I'm in and the group I was with, from the time Medicaid became available till I left practice, we took those patients, Medicaid patients. And many of them, we didn't get paid a lot of money, but that's what physicians do. We care for people who are uninsured and people who have policies like Medicaid. But this new policy, the insurance policies must cover these benefits in order to be certified and offered in the health insurance marketplace. States expanding their Medicaid programs must provide these benefits, these essential health benefits, to people who are newly eligible for Medicaid. So that means at the end of the 3 short years, that percent that the state has, which is no guarantee, is going to be a large sum of money, and much larger than I had thought of after I started seeing these premium increases. The other thing that's been said out there, and I've heard it for the last 4 years, is Republicans have no ideas about health care reform. Well, there is a plethora of ideas on this side of the aisle for health care reform. And one that I happen to have right here in my pocket is a Republican study committee called the American Health Care Reform Act, which I chaired the health committee that wrote this bill. Dr. Tom Price, Dr. Brown has a bill, Louis Gohmert, others. There are many of them. The Republicans substituted a bill of 4 years ago, an excellent health care bill that's market-centered, and it does something that I think is essential for the American health care system to survive as we know it, and that is to maintain the physician-patient relationship. This will tear that down, because what does it do? So many people are going to lose access to their doctor, and as there are fewer and fewer doctors out there to see you, the waits are going to get longer and longer and longer. And I think that is the very fabric that's made us the system that we are in the envy of the world, where people come from all over the world. And I think that can cease. And when you see great universities like Vanderbilt University cutting down on the number of doctors they're educating because of these cost constraints, and cutting down on the number of young doctors that are going, the MD, PhD programs that go into medical research and into faculties in medical school, boy, 10, 15, 20 years from now, we're going to suffer a great price for this mistake we've made right now. I'd like to take now the opportunity to introduce one of my colleagues from Georgia, a family practice physician, Dr. Paul Brown.
Thank you, Dr. Rowe. The federal government is out of control. It has become too big. It is spending too much. It is taxing too much. It is regulating too much. It is borrowing too much, and is sticking its ugly nose into our business too much. It has to stop. And Obamacare does every one of those things. As a medical doctor, I understand firsthand the disastrous effects of Obamacare and have been fighting from the very beginning to stop this terrible law. Every day, I hear from one of my constituents in the 10th District of Georgia on how this law is hurting them. Premiums are increasing. Cancellation letters are flying all across the state of Georgia. And business owners are being forced to lay off employees. And patients are finding that they no longer can afford their health insurance altogether. To share with you a few examples. One Georgia businessman, who is the owner of several fast food restaurants, currently employs over 200 full-time workers. He recently told me that he is seriously considering letting them all go and hiring only part-time employees. This due to the burden of Obamacare. A resident of Henry County wrote to me that as an uninsured woman with pre-existing conditions, she was looking forward to enrolling in Obamacare. Then when she went to sign up, she found that a quarter of her income would have to be paid in premiums alone. Due to the high cost, she had no other choice but to remain uninsured. One man from Monroe, Georgia, contacted me just last week to inform me that his insurance costs have increased by 800% due to Obamacare. A woman from Barrow County told me that her husband's insurance that he bought through AARP has already been canceled. And to get another policy with the same coverage would cost him $150 more a month than what he's paying now. This couple currently pays more in health insurance than what they pay for their mortgage. Increasing their payments by an extra $150 a month would be a tremendous financial burden on them. Sadly, this is just the beginning. It is expected that more than 400,000 Georgians will lose their current health insurance due to Obamacare. Until we are able to stop this disastrous law, we will continue to hear more and more of these stories. As a medical doctor, I know what is best for my patients. That is why I've introduced legislation, H.R. 2900, the Patient Option Act. It would repeal Obamacare in full and put patients in charge of their health care decisions, where they can buy health insurance at a cheaper price than that they are currently paying. My Patient Option Act was endorsed by FreedomWorks in the last Congress. My bill will make health insurance cheaper for everyone, literally cheaper for everyone, not like the President promised us, but he lied. It will provide access to good quality health care for all Americans, and it will save Medicare from going broke. If Americans want full control of their coverage, health insurance at a lower cost, and the freedom to make their own decisions in health care, then the Patient Option Act is the only true solution. It is clear that Georgians and Americans are hurting under Obamacare. That is why I will not stop fighting to rip Obamacare out by the roots and to replace it with reform that will actually lower cost, deliver care, and focus on the true needs of all American families. Through the voice of we the people, demanding the repeal of Obamacare, we can work to repeal Obamacare and replace it with legislation that serves the best interest of patients, not government. That solution is my Patient Option Act, H.R. 2900. And I yield back to Dr. Rowe.
I thank the gentleman for yielding, and I'd like to spend a few minutes now beginning to talk a little bit about the effects on businesses and how this will affect individuals. I serve as the chairman of the Health, Employment, Labor, and Pension Subcommittee on the Committee of Education and the Workforce. And we've held several hearings around the country over the last 2 or 3 years outside of Washington, D.C. We've held them in Concord, North Carolina, been to Evansville, Indiana, Butler, Pennsylvania, Lexington, Kentucky, and others. And we've actually asked small businesses to come in and testify on how this plan will affect their business. Let me give you just a couple of examples. We were looking at a small textile owner in North Carolina, and I won't mention his name tonight, but anyway, it's part of the public record. But he has a business where he had supplied his business. He was self-insured, as many small municipalities, large municipalities are. Many businesses are self-insured, and it didn't look like that their plans were going to be affected too much by this, by the Affordable Care Act, the Obamacare bill. However, they have to pay a $63 fee per person insured. Most people don't know this because it doesn't personally affect them. It just affects the business owner. Or in the case of my hometown of Johnson City, Tennessee, that little bill is going to come to $177,000 next year. One major corporation, which will remain unnamed, came to my office and shared with me that their bill for that this year would be $25 million. And let me explain to you about this small businessman in North Carolina. He provided 80% of the health insurance. The employee paid 20. He paid all preventive services. If you needed a colonoscopy, your wife needed a mammogram, he paid 100% of it. He had a nurse on site and a wellness program that he paid for. It is the Cadillac of all Cadillacs. So what does he get for that? He gets a $63 fee for every single person he's insured. This year, the following year it decreases a little bit, and the following year. And guess what that money's used for? That money is used to indemnify insurance companies so that they will provide insurance on these exchanges and will limit, it's a stop loss for them. That's how complicated this bill is. Now, I have had numerous businesses that are in the 50 range that I've talked to at home. And where we are, small business is the kingpin. That's the majority of our people are employed by small business. What incentive is there for a business to go above 50 when this arbitrary number was picked? And I have no idea to this day why 50 was picked. And so what's magical about 50? Well, if you go above 50 employees, as my practice is, and you decide not to provide health insurance, and you are now, that costs you $2,000 per employee as a fine, tax, penalty, whatever Judge Roberts wants to call it. But that's what it is, a tax, I assume, a penalty or a fee on those. Many people are willing to pay that, businesses are, or if they are at 47 or 8, guess what they're doing? They're not going to 50, or if they need more employees, what are they doing? They're hiring part-time people. And I can assure you, I've heard this over and over and over again about how businesses are cutting back their employees' hours to under 30 hours a week, because now we've defined full-time employment as 30 hours per week. And I assume the only place 30 hours a week is full-time employment must be France, because there isn't any place I know of on the planet that 30 hours a week is full-time employees. Certainly not in Tennessee, it's not. I would like to now yield time to Dr. Gingrey again, my friend from Georgia, if he would like to have a few words to say.
Mr. Speaker, I thank the gentleman for yielding me additional time, and I know there's another member of the House GOP Doctors Caucus that just joined us, and so I'll just take a moment, yield back to Dr. Rowe so he can yield to Dr. Harris. But I wanted to take just a moment to emphasize what Dr. Rowe was talking about, Mr. Speaker, in regard to these mandates. The Affordable Care Act, we've found out now that it's the Unaffordable Care Act. But, Mr. Speaker, all of these mandates that are larded up into this essential coverage that the federal government is requiring is the reason, that indeed is the reason that the cost is going up. You can't include all those things that Dr. Rowe was talking about without somebody paying for it. Now, we talk about other options and what we on the Republican side, particularly the physicians, have offered in regard to alternatives. Many states have a lot of mandates in their health insurance program, and under current law, you can't buy health insurance in another state. And so we have been pushing for years, the whole time, the 11 years that I've been here, to pass what's called an association health plan, where a group or even an individual can go on the internet and probably not have the trouble they're having with healthcare.gov and find out that in Tennessee, maybe there's a policy that fits them to perfection. They're a 55-year-old single man who doesn't need infertility coverage. Maybe their state requires it. He doesn't want to have to pay for that, so he can get a more cost-effective policy that it fits his needs to perfection by buying that health insurance across state lines. That's something that the other side of the aisle has completely rejected, and yet they have the mendacity, the audacity to say that we have no ideas, we have no plans, we have no alternatives. Indeed, we do. I yield back to the gentleman from Tennessee.
I thank the gentleman for yielding, and before I introduce our next speaker tonight, my colleague from Maryland won, Dr. Andy Harris, who is on the faculty at Johns Hopkins University, and he's an anesthesiologist, has been a great member of the Doctors Caucus, and I hope that Dr. Harris will address some of my concerns in his remarks about educating future young physicians. That's a great part of my life, and certainly I want to see that continue. I think one of the things that also struck me was in our colleges, how it affects, we didn't think it would affect universities much, but in our community colleges, I've talked to a lot of them. One of them was over in North Carolina. Many of them now are limiting their adjunct faculties. And what an adjunct faculty member is someone who's not there full-time, but they may need a specialty in, let's say, in accounting or physics or math or whatever it may be, and they may teach several classes. They now have limited those hours, those classes, to simply 3 per semester. And the reason is because they'll have to provide all of these benefits if they go above that, because our good friend the IRS has determined for every hour you spend in class, there are 2 or 3 hours that is counted for preparation for that class. That's counted as work. So now community colleges are cutting back the number of hours students can be taught by this particular faculty member. The reason that's important is because a student may need a certain subject that's out there that this faculty member teaches and can't get it and delays their graduation. We've had community college presidents tell me this can be the case in their community. The state of Virginia has cut back to many part-time workers, and I think Secretary Sebelius was in front of our committee and stated that this was just basically people just talking about it and a supposition. And I said, it's not true, because people are making those decisions in lieu of what's going to happen. That's what businesses do. And now, Mr. Speaker, would like to yield to my good friend, Dr. Andy Harris from Maryland.
Thank you very much, and I want to thank the gentleman from Tennessee for yielding. You know, the gentleman from Tennessee is absolutely right. In fact, in Maryland, in a front-page article 2 weeks ago in our leading newspaper, the front page above the fold was a story about how Maryland's community colleges are cutting back their adjunct faculty to make sure none of them teach more than 30 hours a week. And it's just like the doctor from Tennessee says. Some of these faculty are important. You've got to have them to fill in niches in your curriculum. And now they're constrained by a 30-hour-a-week definition of full-time work. And, Mr. Speaker, the fact is that, remember, it's not just that when you hit 30 hours, you have to offer insurance. You have to offer the insurance the government says you have to offer. And as I'm going to mention from literally dozens of communications I get now on a weekly basis from people in my district, the insurance under the Affordable Care Act is anything but affordable. William in Cecil County writes to me, and I'm going to read these verbatim, Mr. Speaker. My wife and me are currently insured with Maryland Health Insurance Plan. Now, Mr. Speaker, the Maryland Health Insurance Plan was our version of covering everyone with a pre-existing condition in Maryland. So, Mr. Speaker, in Maryland, every citizen had coverage, whether they had a pre-existing condition or not, because they could get it through the Maryland Health Insurance Plan. And, in fact, William writes that he and his wife were currently insured with the Maryland Health Insurance Plan. Just received a letter stating we can keep our insurance. However, when I questioned them for how long, they said until the end of your current policy. So June 30th, 2014, we'll be sent to Obamacare. My wife has multiple serious health issues that our current insurance has kept her alive and able to function pretty normally. Now, Mr. Speaker, William is worried, and he's justifiably worried, because every day we pick up the newspaper and we read about another state where you can't get to your doctor. Your doctor is not going to be on that insurance plan because the only way they can make those premiums less expensive than they already are is to limit who you can go and see when you're sick. Yes, Mr. Speaker, the government telling you who you can go and see when you're sick. And that's what William and his wife are worried about in Cecil County. But Carl in Queen Anne's County writes to me, I have to put in my 2 cents when Obamacare first started a couple years back. My health care started to go up. When we called Blue Cross, they told us, you can thank Mr. Obama, it's went up to $1,600 per month. Now my wife does have stage 4 cancer. I'm a truck driver. I have to pay for our health care. So much for the care cost dropping. Mr. Speaker, I don't know if you remember, but our president said 19 times that the price of a policy for a family was going to go down $2,500 a year. Mr. Speaker, Carl is going to pay $1,600 a month now. It didn't go down $2,500. It went up thousands of dollars a year. Tim from Queen Anne's County, I guess writing tongue-in-cheek, thanking you for the new health care rules that have resulted in our family losing coverage from Giant Food. I'm a general contractor who, after 22 years of coverage with my wife, are now faced with a $1,000 a month bill to cover my family. $1,000 a month. Not $2,500 less, like was promised us, 19 times, period. He goes on to say, I'll bet you still have your insurance. Well, Tim, we not only have our insurance, but because of the President gave Congress actually a special deal that you don't get. Because, you see, Tim, if you got the same deal, your employer could be able to subsidize you on an exchange. That's the deal the President gave members of Congress and their staff. Sorry, Tim, you didn't get that. Fran from Worcester County writes, my Care First Blue Cross policy has been canceled. I chose my policy. My policy was great. President Obama promised more than 24 times that, quote, if you like your health care plan, you can keep your health care plan. Now, this is Fran's opinion, not necessarily mine. I believe that he knowingly lied. What are you going to do about this? Fran, I got to tell you, I think it might be too late to do anything about it. This horse has left the barn. Millions of Americans have gotten their cancellation notices. Millions more Americans have gone on the exchanges to find out that their plan is not going down $2,500 a year. It's going up an average of, Mr. Speaker, $5,000 a year for the average family, a 41% increase on an average premium this year of $12,000. Andrea from Harford County writes, I just thought you might like to add my family to the statistics of the government's intervention in my perfectly fine 20-year-old Care First Blue Cross Blue Shield insurance plan. I'm self-insured, quote, hence the first to be and Mr. Speaker, I'm not going to say the word here because of decorum on the House floor. When I am forced to accept the new, not as good, higher deductible, limited doctor choices, I will be paying an increase of, this is what Andrea writes me, 197.5%. Mr. Speaker, Andrea's not getting a $2,500 a year cut in her family insurance plan. She's getting a 197.5% increase.
Would the gentleman yield?
Yes, I will.
Then how do you answer to her the pundits that we've heard all last week and some of our colleagues here on the House floor, including the President, who said these were substandard plans, that these individual plans were. And I've just heard you say, Dr. Harris, 3 or 4 times that people were perfectly satisfied. They met their needs. I yield back.
Thank you very much. Reclaiming the time, I'll tell you about more. I'm more than happy to share these with the President. He wants to call up Andrea and explain how a 197.5% increase fulfills his promise. More than happy to have him done. Andrea goes on to say, I'm not feeling the love. I believe the Congress and the President should have to live under the same laws, rules, regulations that they insist I do. Andrea, I couldn't agree more. I don't know why the President carved out a special exception for members of Congress and their staff that they actually can get their employer to subsidize their plan on an exchange when no other employer in Maryland, in the United States, that employs 15,000 people, because, Mr. Speaker, that's what the Congress employs, get that kind of deal. Andrea, you're absolutely right. I think they should live under the same rules. That's why, Mr. Speaker, on September 29th, rather, we sent a bill over to the Senate that said, you know what, no special deals for Congress. Senate rejected it. President said he'd veto the bill. He wants to keep that special deal. Not for Andrea, but for members of Congress and their staff. He wants to keep that special deal. Matthew in Queen Anne's County writes, tongue-in-cheek, I would appreciate if you could pass on my appreciation to the President for the Obamacare legislation. Thanks to the new law, my employee-sponsored health plan has increased my premiums by 100% for my family plan. So much for looking out for the middle class. Mr. Speaker, Matthew hit the nail on the head. The President promised if you like your plan, you can keep it, period. You can keep your doctor if you like him, and your family's plan is going to be $2,500 a year less. Mr. Speaker, Matthew's plan is going up 100%. How in the world can someone in the middle class afford that? How in the world can we ask our hardworking middle-class men and women with a family to pay 100% more for their health care? We can't. We shouldn't. Gets worse. Linda from Cecil County. Linda writes, I have a genetic disorder called Lynch syndrome that predisposes me to a number of cancers. Yeah, Linda was born with a syndrome where she is actually susceptible to getting cancers. I've had cancer twice in the past 7 years and was fortunate enough to be covered by MHIP. Remember, Mr. Speaker, that's the plan we already had in Maryland, over 30 other states that covered their people with pre-existing conditions. She was fortunate enough to be covered since she was first diagnosed. This program was truly a godsend, and I can tell you how grateful I was for it, as I did not then, nor do I now, have employer coverage. I was not eligible for Medicaid at the time because my unemployment benefits disqualified me. She received a cancellation of her policy effective December 31st, and it is advised that she should purchase insurance through the new exchange. But, Mr. Speaker, she says, I began trying to obtain insurance as soon as the exchange opened. Although I was able to establish an account and an application, I was informed that I'm not eligible for a tax subsidy because I'm eligible for Medicaid. While many people might be happy to receive free Medicaid, it creates a nightmare for me. That's what Linda in Cecil County writes. The President's Affordable Care Act is creating a nightmare for her. She goes on to say there are very few specialists in Cecil County. By the way, that's a rural county in Maryland. And so nearly all my doctors are in Delaware. Since they don't take Maryland Medicaid, I can no longer receive treatment from them. Well, that's a real benefit, Mr. Speaker, that Linda got. I'll have to travel twice the distance to obtain all new doctors if I'm forced onto Medicaid. Mr. Speaker, that's what the Affordable Care Act is doing to Linda. Thank God, there but for the grace of God go I, that I don't have Lynch's syndrome. She does. She worries every day about going to a doctor and being told she has cancer. And what the President's Affordable Care Act told her, you can't go to the doctors you're used to going to who have guided you through those cancers, who are saving your life. We're going to throw you into a whole new plan, Medicaid, and oh, by the way, you can't go see your doctors anymore. Mr. Speaker, that's heartless. That's just heartless. She goes on to say, MHIP saved my life, and I've had excellent coverage and care for 7 years. Mr. Speaker, Linda liked her plan. And, Mr. Speaker, she doesn't get to keep it. She doesn't get to keep her doctors. She gets to wake up every morning now worrying about her cancer and whether she's going to find a doctor who can take care of her, because she had those doctors. She doesn't have them now. She had doctors close by. Yes, she had to cross state lines, but her health insurance covered it. Her new health insurance doesn't cover it. Mr. Speaker, that's what this plan is doing. This plan affects each and every American in ways we are only beginning to understand. As was famously said, you got to pass this bill before you know what's in it. Mr. Speaker, we're finding out what's in it. America's finding out what's in it. 5 million people found out this month what's in it. It's a cancellation notice for the plan they liked. These people had plans they liked. They weren't throwaway plans. They saved Linda from cancer twice. Every single American is going to be affected by this in ways we are just discovering, and America doesn't like it. Mr. Speaker, very simply, America deserves better. And I yield back to the gentleman from Tennessee.
I thank the gentleman for yielding.
If the gentleman yield, just to suspend just a moment, members are reminded to direct their remarks to the chair and not to the perceived viewing audience. Members are reminded not to engage in personalities toward the President. The gentleman is recognized.
Thank the Speaker. And, Mr. Speaker, I'd like now to mention a couple of things about the and I wanted to talk about this a little bit. We don't have a lot of time left, but it is extremely important, and I know that both my colleagues on the House floor tonight, Mr. Speaker, have taught in medical schools, and we have a huge problem in this country with graduating enough doctors and educating them. Let me give you an example. When you graduate from medical school, you're not then prepared to go out and practice. You need to go to either do your specialty training, or it's surgery or whatever it may be, or a family practice residency, a primary care residency. In my small town of Johnson City, Tennessee, we've lost about 50 primary care residency slots. That's 50 primary care doctors per year that are going to have to look elsewhere for a residency. Last year, for the first time in my lifetime, we had over 1,000 young students graduate from medical school with huge debt that could not find a residency program. That were 1,000 students that are doing something this year before they can get into the residency they need to train to be able to take care of us as patients. And we have the American Medical Association and others have said in the next 10 years we'll have 90,000 too few doctors to see us. Well, we all know what that means. That means that we wait longer and longer to see the doctor. And I think it's a tragedy that's out there that we have young doctors. I can't imagine graduating from medical school when I did, Mr. Speaker, and not being able to find a slot. And the reason that's happened is because Medicare pays a certain amount, a cap that they put on to pay for residencies to train young doctors. And then hospitals and universities, through their endowments and other income, put more money in to help train these doctors. Well, what's happened is, because of the Affordable Care Act, the hospitals are getting less money, and they're having to look to cut. That's why they're cutting their staffs. That's why they're cutting residency programs and delaying training. And folks, let me tell you, downstream, Mr. Speaker, this is a very, very bad thing for us in the health care of this nation. And I'd like to yield some of our last minutes to Dr. Gingrey from Georgia.
Mr. Speaker, I thank the gentleman for yielding, and I did want to speak about the young people, and I'm talking about those who have their 27th birthday. They're age 27, so they're not eligible any longer to be on their parents' health insurance plan. I have concerns over the effects of this law on these young people, and I have warned for some time, and I've even introduced legislation to insulate the young from rate hikes, which are the direct result of these age band provisions in the Affordable Care Act. Health insurance companies know, their actuarians know, they're educated, they've studied, they've gone to college, they've gotten master's, advanced degrees in figuring out what the premiums need to be at different age bands. And the federal government has come along in this law and said, well, it doesn't matter, you can't charge any more than 3 times the premium for, let's say, a 62-year-old versus a 28-year-old. And what that is doing, of course, is making the insurance companies just simply raise the premium for everybody so they can possibly make a profit. And I just want to conclude with one thing, Mr. Speaker, and then I'll yield back to Dr. Rowe for some closing comments. But when this bill was marked up in 2009 in my committee, the Energy and Commerce Committee, as it was in Dr. Rowe's as well, I submitted an amendment that said very simply, if you're going to cram the Democratic majority party and President Obama, if you are going to cram this down the throat of the American people who don't want it, they've said they don't want it. 60% of them said we don't want it. But if you're going to make them accept this, then, Mr. President, you're the First Lady, your 2 beautiful daughters, all of your cabinet members, all members of Congress should also have to abide by what we the people have to abide by. And that amendment, my amendment, was rejected. Strictly straightforward party line vote. All of the Republicans on committee voted for it as a fairness issue, and all the Democrats voted against it. So what happens? A Republican senator put it in their version, which gets in the bill, but there is all of a sudden no subsidy. So therefore, the President, by executive order, is saying that, oh, okay, these members are now in Obamacare, but because of their income, they're not eligible for any subsidy. So we're going to let them keep what the Office of Personnel Management gives them, our tax dollars. 70% to 75% of the premium is paid by we the people to members of Congress. That is grossly unfair, and I just want to make sure that all of my colleagues, Mr. Speaker, understand that, and I think they do. And I yield back to Dr. Rowe.
I thank the gentleman for yielding. In conclusion, let's go back and look at why we needed health care reform in this country. We needed it because costs were rising, and we had a problem with access for many of our people. And that clearly was true. There's no question about it. And there were problems with pre-existing conditions. We know that. The Republican Study Committee has a plan out there called the American Health Care Reform Act that addresses all of these issues and truly does lower costs and does one important thing that I mentioned earlier in my remarks. I think the patient-doctor relationship, medical decisions should be made between a patient, the doctor, and their family. And that's who should be making them, not the insurance company and not the federal government. And you should be deciding what you purchase. And we've talked about a lot of complicated issues here tonight because this is a very complicated bill. But it's important for everyone to understand it as best they can because it affects every American citizen. And that is why us on the Doctors Caucus and the Republican side of the aisle read that bill and tried to understand it because it was going to affect every citizen in a very personal way. We want to continue this discussion on the House floor. I've certainly enjoyed this 1 hour with you this evening. And, Mr. Speaker, I yield back the balance of my time.
The gentleman yields. For what purpose does the gentleman from Tennessee seek recognition?
Mr. Speaker, seeing no further business, I move to adjourn.
The question is on the motion to adjourn. Those in favor say aye. Aye. Those opposed, no. The ayes have it. The motion is adopted. Accordingly, the House stands adjourned until 10 a.m. tomorrow morning for the morning hour debate.
So the House is gavelled out, but members return Wednesday at 10 a.m. Eastern for morning hour speeches and noon for legislative work. On the calendar tomorrow, a bill relating to asbestos claim reporting in cases where exposure might have occurred and what payouts for injuries took place. Later this week, work on a bill aimed at reducing lawsuit abuses and another one that would restore canceled health care plans. That measure would allow insurance companies in the individual market to continue to offer those plans in 2014, even if they do not meet the minimum coverage requirements in the health care law. You can follow the House live here on C-SPAN when members gavel back in on Wednesday.